Hello, everyone. I'm Dr. Kavita, and you're listening to the Unlearning Podcast. I want to bring up the Lindsay Clancy case today because the trial, as of right now, is ongoing, and it really is highlighting the important topics about postpartum care, specifically postpartum psychiatric care, how her care was, and whether there was any negligence or no, and if that factored into the tragedy that happened. Just for a timestamp, this recording is on Tuesday, August 11th, 2026, around just shy of noon. First off, I want to say, for those of you who are not familiar with this case, it is really such an unfortunate tragedy that happened on January 24th, 2023. Lindsay and Patrick Clancy's three children, Cora, who is 5 years old, Dawson, who was 3 years old, and their infant son, Callan, who was just 8 months at the time, were all three murdered via strangulation, and allegedly Lindsay Clancy then tried to take her own life by jumping out the second floor window of their home. And so it's more than 3 years later, and the trial now for this, it just started last month, July 2026. It's interesting to see online and on social media all of the different comments about the case and the trial as it has been unfolding, including the misinformation, which is a big reason why I want to shift gears and talk more about this case. As a psychiatrist who practices in the outpatient setting, and on trial right now are the clinicians who are taking care of her, and they're talking about her regimen. And so as a fellow psychiatrist, it's just really something to watch, and I want to definitely give my 2 cents. And on that note, I want to point out this is just my opinion, and the views I'm about to express are solely my own as a practicing psychiatrist, but given just the information that is out there, not as like a direct treating clinician for her. So yeah, I wanted to mention the children at first because this is the heart of the tragedy, and my condolences go out to their family and their loss. And as a mom myself of 2 littles, it just, every time I'm reading about this case, it's just so deeply saddening. I was in the postpartum period just 3 years ago with my youngest, and it just, I know you other moms out there can relate in different ways as far as how hard it is and how it's like, and all the changes and the challenges. So this just really touches my heart, this whole case. So I think before diving into more of the details of this case, I just want to go over what is postpartum depression, postpartum anxiety, and postpartum psychosis, because they have been brought up a lot, especially after the trial has started. And so I just want to clarify, they can easily be their own episodes individually, but I just in a nutshell want to summarize what are those different conditions, and then differentiate it between baby blues, because these different terms can't be thrown around as if they're interchangeable, because they're not. So for baby blues, that can commonly happen after giving birth to a child, where there may be some sadness, tearfulness, worries about whether, as mom, am I feeling ready for this? Am I capable? Am I going to take good care of my baby? And some mild worries or anxieties along those lines, because it's a huge shift, especially when you go from 0 to 1 pre-pregnancy life and then having a child, and it's the biggest life change. Like, of course, there's going to be all sorts of like concerns and worries about whether you're doing a good job or not, and so I want to validate that and highlight that there's the baby blues, and the difference between that and postpartum depression is where we're having more than just just sadness. I noticed that people bring up those terms, oh, I'm feeling sad, I'm feeling depressed, as if they're interchangeable. But in the mental health world, clinically, there is sadness, which is in the normal spectrum of human emotion. And then there's depression, like clinical depression, which is something for us to really worry about and needs a doctor's attention. With postpartum depression, it can present with a lot of the similar depression, general depression symptoms, such as severe low depressive mood, feeling hopeless, like what's the point? I feel like things are not going to change, or feeling really helpless as if nothing can be done for you. It could present with low motivation and loss of interest in things you normally enjoy, sleep issues, changes in appetite, whether you're sleeping too much or not enough, eating not much versus eating too much. And what makes it, I think, a bit more difficult in differentiating postpartum depression from the expected experiences of just having a baby. The sleep deprivation, for example, is real. So with sleep, it could be a little bit trickier to tease out, because sleep deprivation is just how it is in those first months after giving birth to a baby, with, as they say, the sleepless nights. Be ready for it. And you're having to feed your baby every 1 to 3 hours. So that also is something so important to highlight, because that sleep deprivation also is such a huge risk factor for developing, whether it's postpartum depression, postpartum anxiety, and then postpartum psychosis. Sleep is huge. There is that notable difference between baby blues and postpartum depression, where it's really impairing for the latter, for postpartum depression, and it could lead to suicidal thoughts. So that's one big distinct difference. Is with baby blues, you would not expect to have self-harming thoughts or thoughts about wanting to hurt yourself or die or kill yourself, which are suicidal thoughts. That is a sign that postpartum depression in particular is on a more severe level. In a nutshell, postpartum anxiety can present with extreme worries and anxiety that's hard to control, that's ongoing, that your brain keeps bringing up, and because just to differentiate again between, as I did with sadness and depression, anxiety to a degree is in that spectrum of normal human emotion too. It can serve a purpose when it's at the right level, because we want to feel that epinephrine effect where we're then more focused and more ready for the task at hand, whatever it is. So having a little bit of anxiety before giving a speech or before recording a podcast, it could be like that's expected and actually helpful. It's just when it's on steroids, or when anxiety goes too far to an extreme and is uncontrollable and taking a lot of your day, and that's where we're seeing clinical anxiety that would also need a doctor's attention, because it can be impairing. And clinical anxiety in that regard, where there's criteria met for an anxiety disorder, is what would need, like I said, mental health attention. It's more severe. And with clinical anxiety in that regard too, it can lead to suicidal thoughts as well when it gets more severe. So there's that other important feature. Postpartum psychosis. So what is that? It is rare. I just want to highlight from the different stats I've seen, about 1 in 1,000 women can present with postpartum psychosis, and it can present with symptoms of delusions, which are fixed false beliefs that are not based in reality. It could present with hallucinations, which can include auditory, visual, or tactile hallucinations. So auditory meaning hearing voices as if someone's there, but there's no one actually there, or seeing things that aren't there. Or with tactile hallucinations, that includes like things that they may be feeling, that like bugs crawling on your skin, but there's nothing there. I know the term psychosis gets thrown around so easily, like, oh, that person's psychotic, and like clinical, true psychosis symptoms are the things I just mentioned. They're not based in reality. And for postpartum psychosis, it is a medical emergency. The American College of Obstetrics and Gynecology has an official statement stating that when there is a case of postpartum psychosis, it is a psychiatric medical emergency. So yes, I just want to highlight that psychosis symptoms in general can present in many different conditions. Psychosis is just like the umbrella term to describe it. We can see these symptoms in conditions like schizophrenia and bipolar disorder with psychosis, to just name a few. There's another important feature too with psychosis, that disorganized speech and a disorganized thought process. So what they may be saying may not make complete sense. They may be going from one sentence to another and they're not really connected. And so that's another one of the psychosis symptoms. So I think why this is so important to highlight for the Lindsay Clancy case is because the defense, including Lindsay Clancy herself, is stating that at the time of the murders, she was experiencing a postpartum psychosis episode. And from the literature out there, postpartum psychosis can present suddenly, and it has an on and off or waxing and waning course, meaning it can suddenly present with out of nowhere. So it's like acute psychosis symptoms, basically. That could be the very scary part of it, because mom can at one point present as clear and coherent and lucid and without any signs of those psychosis symptoms. And then because it can, be on and off, that's the nature of postpartum psychosis, it could kind of present then out of nowhere where they've lost touch with reality and they are having those psychosis symptoms of hearing voices, delusions. And that's what the defense team is saying, that at the time before the murders, she was experiencing command auditory hallucinations, is what it's called, or voices telling her that she needed to kill her children and then kill herself after. That, in a nutshell, is what the defense team is saying. And just to put out there, there's a difference between what we may see and diagnose clinically and state and what they're doing in the trial now, because from a legal point of view, they're trying to see if Lindsay Clancy is not guilty due to insanity. And so just to put out there, there's that difference between that and what's been going on for her medically and psychiatrically. Another thing I've noticed so far with the coverage of the trial is the names of her medications, who was treating her, what doses she was on. And just to clarify, because there seems to be some confusion when the generic name of medications is being brought up versus the brand name. And so in the end, they're talking about the same medicine. For example, the first medication she was prescribed by her psychiatrist back in, I believe it was September 2022, was Zoloft. That's the brand name, and the generic name is sertraline. It's the same medicine they're referring to in the end, which is an SSRI, which stands for a selective serotonin reuptake inhibitor. What that means is it is an antidepressant, anti-anxiety medication, which was recommended and prescribed to help Lindsay with her depression and anxiety symptoms at the time. I know the defense, and this was just yesterday, August 10th, who was questioning Dr. Jennifer Tufts, who was Lindsay Clancy's treating outpatient psychiatrist. He was questioning the reason for prescribing Zoloft. And when Lindsay had a diagnosis of generalized anxiety disorder, And technically, it does not have FDA approval for that specific diagnosis. However, Zoloft has been well established and so studied, is known to have good anti-anxiety properties at the end of the day. Again, an outsider's perspective and not one who is treating Lindsay Clancy directly, like seeing it as a fellow psychiatrist that she was prescribed Zoloft at that time for those reasons seems so reasonable. And then for the defense again to say that, or to ask the psychiatrist, why did you prescribe Zoloft when it would have side effects of trouble sleeping? And again, just for general reference, response to medication can vary person to person. Not everyone can have increased difficulty sleeping after starting a medication like Zoloft. Could they? Yes. Does it always happen? No. And so she was already, Lindsay Clancy that is, having issues with sleep at that time before being prescribed the Zoloft. From what I read, it seems like it got worse, and that can be a common response after starting medicines like Zoloft. It's called like having an activating side effect from it, where we can have initially some increased anxiety, irritability, insomnia, or trouble sleeping, and it usually is temporary, but not always. And also, depending on how severe it is, it could be difficult to tolerate or distressing for the patient. So if they're saying it's really bothersome, then that would be reason to switch it to a different medicine. The other point the defense team was making with Dr. Tufts was that when Lindsay Clancy walked into the courtroom, that was the first time that she saw her patient in person. They kept mentioning, you saw her on the TV for 14 telehealth visits. I want to point out that, especially after the COVID-19 pandemic, telehealth care boomed, thankfully, because it increased access to care in a time when everyone was quarantined and gave care to those who really needed it. And since then, it's stayed to a big degree, and again, for good reason, because as it is, especially for psychiatric care, there's issues with getting access to that much needed care, and telehealth provides a much needed bridge to give those the care that they need when they're not able to see anybody else. I will say, especially as a hybrid psychiatrist, meaning I see patients in person and via telehealth visits as well. And it sounds like from the trial thus far that Dr. Tufts had the ability to see patients in person and virtually too, depending. I just sense that the way Kevin Reddington, the defense attorney, was describing telehealth care, I know why he's phrasing in the way he is for the defense team's purposes. However, it should not undermine or undercut the value that telehealth care provides. I know, speaking from my own clinical experience, because there is telehealth care, patients are able to do visits from their car or in front of school or in front of wherever they need to be. They are able to keep appointments more so because of that virtual option, and they could do it easily from their phone and then go on with their day-to-day and be more functional and efficient. So this is something else I want to highlight too, as a general note, because this whole case has brought more to the surface the importance of identifying, diagnosing postpartum depression, postpartum anxiety, postpartum psychosis. I think that part so far has been really good, and us talking more about it, because I definitely feel it cannot be talked about enough. And I can relate as a mom who's been there, and as far as experiencing the challenges in that postpartum period, It's so much change and it can be so difficult. So I just give so much empathy to all of my fellow moms out there and caregivers who are taking care of their children and their families and just trying and doing their best and trying to adapt and adjust to this huge life change. Whether you're going from 0 to 1, 1 to 2, 2 to 3 kids, wherever you're at in that life transition. In general, it's just so hard, and it's even harder for those who don't have a village, and my heart goes out to those even more so, because those are the families that I've seen, the single moms who are trying to make it work and working 2 jobs or more to make ends meet and take care of their kids, and or other caregivers who are just even like grandparents and aunts and uncles. Like, for anyone who, whether you've just given birth to a child or adopt a child, whatever the circumstance is, it's such a huge transition and a lot to adjust to. So this case has made me wonder more so about how much shame there may be with seeking mental health treatment in particular, and how much stigma is still out there. Those who are suffering maybe from postpartum depression or anxiety and psychosis may be so hesitant in getting care, whether there's embarrassment, shame, fear of being judged, you name it. And I want you all to know you're not alone. And if you are feeling that shame or embarrassment, or you're afraid, there is help. It can start with a conversation with someone you trust and love in your family or circle of friends. More importantly, try and think about going to your doctor to talk about it if you're not sure as far as what you're experiencing, because at least starting that conversation can then lead to getting the help that you deserve and need. In the Lindsay Clancy case, it seems like, so far at least with what has come out with the trial, she was vocal and advocating in her own care, it seems, for Lindsay Clancy, and she was in the medical field herself, just FYI, as a labor and delivery nurse. So she had some understanding, it seems like, to a degree, of medications and being able to talk with her clinicians, because so far in the trial it's mentioned that she was using the MyChart messaging or portal system, and it seems like she was utilizing that regularly to communicate in her care. That actually was really nice to hear, because it really seems like she was trying her best as far as what's been covered so far, in trying to get what she needed. And then she had mentioned at some point cross-examination of her clinicians. As of right now, Rebecca Jolota, who was her psychiatric nurse practitioner, is being questioned about what she prescribed and why she prescribed it. And Lindsay Clancy allegedly reported having intrusive thoughts in December 2022. And the murders happened January 2023. I really want to bring that up more and talk about it, because intrusive thoughts can indicate different conditions potentially. If one is having clinical depression, and specifically postpartum depression, you can have intrusive thoughts that could be self-deprecating in nature or exhibit extreme guilt and suicidal thoughts too. So it could be part of that condition. It could be also from OCD. So that's a different condition, clinical obsessive compulsive disorder. The O part, which stands for obsessions, that part can present with intrusive thoughts as well. And I know that's one of the conditions they are trying to tease out and see if that was part of what she was having, or bipolar disorder, which I'll get to. These intrusive thoughts can be what's called ego dystonic, meaning they are not thoughts that the person wants to have. They're distressing, they're bothersome, they're intrusive, meaning their brain keeps bringing it up and they can't help it. I've noticed that there could be so much shame with like the nature of those intrusive thoughts, where patients can have hesitance in bringing up what they're about because they're ego dystonic, meaning they're not thoughts that they would normally have, and it's not who they are as a person. And it could be so bothersome. I really empathize with that, because it could be extreme thoughts of violence or self-harm or things that they would never ever want to do, but it's what their brain is bringing up. It's part of that condition. There could be so much more I could say. And again, that could be another series or episode at the very minimum. But so intrusive thoughts can come up in OCD. And in the Lindsay Clancy case, with the argument being she had postpartum psychosis at the time, it could present with its own kind of intrusive thoughts. But as I mentioned, with what psychosis is, it's having delusions or hallucinations, paranoia that is disconnected from reality. So in this case, patients with psychosis symptoms, they are not able to tell the difference between what is real and what is not real. So that's one important feature. And in the Clancy case, that's the argument, that at the time she was disconnected from reality and hearing voices. So there's intrusive thoughts that someone's having, and then another thing to say that they're hearing voices and having delusions, which are false beliefs not based in reality, and that being a driving factor for her actions. So just wanted to highlight that. So all in all, there's so much more I could say about this case and about the conditions being mentioned. If you're interested in hearing more about these takes coming from a psychiatrist, let me know. Please like and subscribe and follow for more information about the case and about mental health topics in general. If you're interested in hearing about an episode or even more than that on depression in general, anxiety conditions, bipolar disorder, or the postpartum depression and related conditions, please let me know. Comment about it. I would love to hear all of your thoughts and questions if you have any, because as I said, this is ongoing, and I think I'll put a pin in it for now and circle back when the trial is actually over, and then we can really be able to take a deeper dive into what came up and what we can make out of all of it. I also want to say, just bringing up this topic, I'm sure it can be triggering for some of you. And so if you or someone you know is struggling with their mental health or having depression, major anxiety or psychosis, whatever it may be, where you're worried about their safety and or the safety of others, call 988. It's the National Suicide Hotline. It runs 24/7 and it connects you to a trained crisis counselor. There is also the text line equivalent. If you text the numbers 741-741 and you text the word either home or hola, you can then also get connected to a trained crisis counselor 24/7. These resources are national resources that you can use anytime, day or night. So another thing I want to say is, like I said, it's my opinion. My medical views or what I share is solely views of my own, and what I share is not intended to diagnose, treat a medical mental health condition. So if you or someone you know has symptoms or you're worried about yours or their condition, please talk to your doctor to get the proper help and more information. Just as a caveat, this information presented is meant to be just for educational purposes only, and it's not meant to substitute medical or mental health treatment. If you or someone you know is worried about what they're experiencing, then make sure you talk to your doctor to get help and the right information. This information that I'm presenting is not meant to substitute a diagnosis, treatment of any medical or mental health condition.